اوكي تسمعون؟
نعم دكتور.
Okay. Do you see this is swelling in the wrist joint? This is what we call it ganglion. This is the common mass in the around the joint. We name it as ganglion. Ganglion here, benign lesion of the joint, usually result from myxomatous degeneration of tendon sheath. Usually it's painless and need no treatment. Treatment only if it is very large or interfere with function. This is what we call it ganglion. It is very common in the dorsum of the foot, in the palmar side of the foot. ممكن أن تكون in any area in which there is tendon sheath or in which there is capsule. ممكن أن تكون بالفوت، ممكن أن تكون in any position in which there is tendon sheath or joints. The ganglion is very common lump. It is not a tumor, it is just myxomatous degeneration of the tendon sheath. Most of the time need no treatment. Most of the time this is method, a primitive method of splintage, what we call it the popular medicine. Or this is the simplest method of splint. Usually you cannot control the femur by such splint. Splint should control the proximal joint and distal joint. Such tight cast might lead to ischemia sometime. Usually the method of holding for fracture, we use it either by traction or by splints like POP, or by internal fixation or by external fixation. This is a chronic hand swelling, and there is deformity of the finger. Most of these deformity result from rheumatoid arthritis. This is entrapped ring in the finger, and there's ulceration of the finger. Usually we treat these patients by cut it by hixo. احنا دائما بالorthopedic there is cutter for metal, so we can cut this metal and remove it from the patient. Usually these will entrap in the ring or in the finger, and it lead to ulceration and even ischemia sometime. This what we call it pointing index, which occur in case of medial nerve injury, what we call it pointing index. This is اسمع محمد.
ايه دكتور نسمع.
ايه دكتور.
This is a clawing of finger which result from ulnar nerve injury, the flexion of interphalangeal joint, hyperextension of the MB joint. This is what we call it partial clawing of the finger, result from ulnar nerve injury. Ulnar nerve injury. And this is a patient with backache. He cannot flex his back. And the examination of back include inspection, palpation, and movement. In movement, we have flexion, extension, lateral flexion, and hyperextension. Usually the patient with back problem, he cannot do this movement. And we can do what we call it straight leg raising test. In the normal patient, we can elevate the straight leg up to 90 degrees. And in patient with prolapse disc or irritation of the disc, if we elevate it for few degrees, usually there is pain in the back, referred to the lower limb, we name it as positive straight leg raising test. The straight leg raising test كل ما تكون يعني less in degree, it means more severe prolapse disc and irritation to the disc. We name it as straight leg raising test. This is hand of rheumatoid patient. This is the hand of rheumatoid patient. Rheumatoid, the common site for rheumatoid arthritis هو الhand joint, and usually it leads to deformity, subluxation, and dislocation of the joint. This is a clinical examination for neonate by Ortolani test. The hip flexed, knee flex, thumb medially, index laterally, and we gradually abduct the hip joint. Usually, if there is dislocation, we feel that the hip enter inside the acetabulum, and we name it as a jerk of entry. This we call it Ortolani test, used for diagnosis of DDH in a unit. The other tests, we name it as Barlow test. The Barlow test, we test for hip which liable for dislocation by flexion of the hip joint, flexion of the knee joint, thumb medially, will index laterally again, and we try to adduct the limb, two knee joint, adduct them, and we push vertically. If the hip is liable to dislocate, we'll go outside, and then we do a gradual abduction like Ortolani test, and the hip will relocate again, and we name it as Barlow test. So this is Ortolani test, and we can do Barlow test for hip which is dislocatable. We test the dislocatability of the
دكتور العفو، هسه رجع النت يمي. بس دكتور بالامر عليك، من يخلص السيشن بعثت لك كان رساله على التليجرام، عد بعث لي تسجيل للتليجرام يكون يعني حمله اسرع
ان شاء الله.
من الدكتور.
This is bilateral DDH, bilateral dislocation of the hip. Both acetabulum is empty, head upward and migrated laterally and outside. So this is DDH, bilateral DDH. DDH is very common, especially in our city, in our country, and it leads to severe disability of the hip joint and disabling in the future of the patient. The DDH should be treated early and diagnosed early. As much as we diagnose the cases early and we treat them early, the result will become better and we prevent complication of the hip joint. This is the treatment in abduction splint. Abduction splint, treatment in abduction splint. Treatment in abduction splint, usually we treat the hip in abduction splint, the age of the patient in month +2. فالطفل اللي عنده DDH وعمره شهر يحتاج 3 أشهر من abduction splintage، واللي عمره 5 أشهر يحتاج إلى 5 زائد 2، يحتاج إلى 7 أشهر in abduction splint. فبقدر ما نقدر نشخص المريض early, the result will become better and the treatment duration become less. الأطفال اللي عبرون 1.5 سنة من العمر دائما they need surgical treatment by open reduction and osteotomy of the femur, osteotomy of the pelvis, and many complicated surgery. فالآن هو early diagnosis and early treatment of DDH. This is bruises, swelling, and blister, and necrosis of skin. This associated with a fracture in the leg, tibia and fibula. How we confirm the diagnosis of fracture? Usually confirm the diagnosis of fracture by X-ray, AP and lateral view. And this is the AP and lateral view for this patient. You can see there is a transverse fracture in both tibia and fibula in the distal third of the leg, displaced and overlap, displaced and overlap. The fracture now we can name it as posterior displacement, posterior. لأنه distal segment displaced backward regarding the leg. The early important complication which occur in the leg fracture like this, displaced and overlap, is compartment syndrome. The other common complication, penetration of skin, لأنه the skin directly attached to the bone. If there is displaced fracture, the skin might be penetrated by sharp margin of the bone and change the fracture from closed fracture to an open fracture. The most common important complication here, compartment syndrome. The other whole skin complication is very common in fracture in the leg. لأن the skin is subcutaneous, it's liable to get fracture and penetration easily. This is spiral fracture of shaft of the femur in the children. Such fracture in shaft femur in the children can be treated conservatively by traction or spica. In adult fracture femur usually treated operatively. While in small children, the canal fracture spiral can be treated conservatively by skin traction or spica. Displaced fracture in children can be treated also by internal fixation. The adolescent usually treated like adult. Any adolescent patient with a fractured femur is better to be treated by open reduction and internal fixation. This is patient with osteomyelitis and the history of fever, swelling, and you can see the discharging pus from the leg. All these features feature of delayed acute osteomyelitis and treated surgically to discharge the pus collection in the leg. These patients, when delayed, usually they will change to chronic osteomyelitis in the future. And this is discharging sinus from the leg. Discharging sinus from the leg, and you can see the necrosis of the skin and pus discharge from the leg. What's the differential diagnosis for this condition? The most common differential diagnosis is chronic osteomyelitis. Acute chronic osteomyelitis, delayed septic arthritis of the joint can lead to discharging sinus. The other cause of discharging sinus will shell, fragment, foreign body in the leg. All these might lead to discharging sinus. Discharging sinus sometimes follow insufficient drainage for abscess. Soft tissue abscess might lead to persistent sinus discharge. This is picture for pathology of osteomyelitis. Start in metaphysis, then abscess form under the periosteum, and the periosteum penetrated by the pus and will extend to the soft tissue, and even it will penetrate the skin, form sinus. This is X-ray for shaft of the femur with moth-eaten appearance of osteolytic lesion in the shaft of the bone with periosteal reaction in the shaft. This arose suspicion of infection first. The other differential diagnosis is tumor like Ewing sarcoma or osteosarcoma. If the picture is acute, in favor of infection, the patient more chronic, in favor of tumor. Always we should need to confirm the diagnosis by biopsy if the condition is misleading or not clear. This is chronic osteomyelitis with deformity of the bone, involcrum formation, sequestrum in the bone, and deformity of the bone, and area of lytic lesion and area of sclerosis. All this is a chronic osteomyelitis or feature of chronic osteomyelitis. And this is unilateral varus deformity of the knee joint. And this is a fracture in the both malleoli and subluxation of the ankle joint. If the malleoli, both of them is broken and displaced with subluxation of the joint, these need open reduction and internal fixation to maintain normal anatomy of the ankle joint to prevent later osteoarthritis of the ankle joint. This is another ankle injury. You can see there's a fracture in the distal fibula, displaced, and there's subluxation of the joint. And such injury must be treated by open reduction and internal fixation of the distal fibula, reduction of the talus in its position, and sometimes we need to repair the medial ligament of the ankle joint, what we call deltoid ligament. This is gangrene of the foot. And gangrene of the foot most of the time results from ischemia. The ischemia, common cause of ischemia, atherosclerosis, diabetes, cold injury are common cause. There are other causes like drug iatrogenic, all these, Berger disease, all these might lead to ischemia of the foot. And this is typical exostosis, lump from the bone, on the surface of the bone, directed away from the joint, directed way away from the joint. This was, we call it exostosis or osteochondroma of the bone. This is central lytic lesion of proximal humerus with pathological fracture without expansion of the bone. And this is the typical simple bone cyst or solitary bone cyst or unicameral bone cyst, all the same name. This is what we call a simple bone cyst, simple bone cyst. And this is lytic lesion in proximal tibia with a trabeculation, subchondral. This is typical giant cell tumor. This is typical giant cell tumor. Sometimes we name it as subbubble appearance. This is patient with moth-eaten lytic lesion of the shaft of the femur with periosteal reaction and thickening of the bone. In case of acute feature, the patient has fever, ill health, toxicity, this in favor of infection. And if the patient gradually develops this picture in favor of tumor, in this condition, we need to do investigation for the patient, X-ray, CT scan, blood investigation. If there's doubt about diagnosis, we can take biopsy from the bone and we examine the tissue of the bone. Differential diagnosis is chronic osteomyelitis. The other, osteomyelitis, chronic or acute change to chronic osteomyelitis. The other differential diagnosis were tumor, Ewing sarcoma, and osteosarcoma. This is lump in the finger, and the X-ray show multiple lytic lesion in the central mid finger. This with a spot of calcification, this typical case of enchondroma, typical case of enchondroma. This is multiple lytic lesion in the skull in favor of multiple myeloma. To confirm the diagnosis, we need to do urine for Benz-Johnson protein, serum protein electrophoresis, and bone marrow aspiration and biopsy. These confirm the diagnosis. Other differential diagnosis, secondary metastasis to the skull. Secondary metastasis to the skull. Multiple myeloma commonly presented with pathological fracture, especially pathological fracture of spine, or bone pain, usually presented with bone pain. And presentation, diagnosis usually depend on bone marrow aspiration. This is mass or swelling of the leg joint. Here, this swelling is shiny red in favor of acute infection. Here, there's no shiny, no swelling of the leg. This is in favor of tumor or lump in the bone. And this is patient with lateral shift or lateral tilt of spine. This is what we call scoliosis. If the patient bend it forward, the deformity become more clear and harm become visible on the back of the patient. This is what we call scoliosis. In a clinical examination, if we ask the patient to bend it forward, the deformity become more clear, and we can differentiate the postural from structural type of scoliosis by bending test. If it is postural, it will disappear. If it is structural, it will become more clear. This is what we call it butterfly vein line used before the availability of the cannula. It can use as a vein line. Also, it can penetrate the bone and used to give fluid through bone. Rarely it's used now. We end this file.
تمام دكتور.
راح نسجل لكم الفايل وندز لكم اياه بالتليجرام.
ايه بعثت لك دكتور رساله هسه يمكن وصلتك على هو نفس هذا رقمك مو؟
ان شاء الله راح ندز لكم اياه ان شاء الله، ونتمنى لكم
تمام دكتور.
توفيق، والله يستركم من كورونا واشباه كورونا.
دكتور بس ما يحتاج دكتور التيم بس يعني الممثل عدي وصاني انه حضرتك بعث محاضره مع تسجيل صوتي. قال بلكت انه تذكر الدكتور على مود حتى يبعث لنا بها تسجيل صوتي دكتور.
هذه المحاضرة
شلون دكتور؟
هذه المحاضرة
ايه المحاضره النظري هم مال كسور حضرتك بعثت فقط الباوربوينت ما بعثت وياه تسجيل صوتي
هذه المحاضرة اللي دزيت لكم اياها بالباوربوينت هاي للاطلاع فقط.
ايه
ها؟
تمام خوش هذا راح اقول له للاطلاع.
يعني للاطلاع فقط، هيك بس للاطلاع، هيك بس تضحكون عليها. يعني
خوش دكتور ما راح نضحك عليها.
هذا الموضوع يعني هي المحاضرة رقم 45 اللي هي الليست أهمية. خوش؟
هذا دكتور صار. تمام دكتور.
شكرا دكتور.
أهلا بكم. Stop.